One of the greatest opportunities in healthcare today is to use AI to go from a manual data extraction process to an automatic one. Using AI to extract data automatically will lead to 1,000 times more data at much higher fidelity. Our healthcare system today relies heavily on manual data extraction at the point of care. This is both a tedious and manual process where you have large gaps in time, so it's sparse in nature. This is what we're using Gefion to build. Gefion is one of the largest supercomputers on the continent, and we're using it to train our AI model to understand what's going on at the point of care. More specifically, we're teaching it this 3D representation where it knows the 3D geometry and structure, and it knows the semantic meaning of each point in this reconstruction. So for example, that this point belongs to the bed, this belongs to the person, and so on. So this representation is not just computed once, but it's computed 10 times every second, which gives a very continuous understanding of how the patient is doing and what care the patient has received. The main advantage to monitor patients rather than having manual check-ins is that it's continuous in time. If you rely on manual data extraction, you only extract information and documentation once you go and check up on the patient. With this system, you basically get a continuous signal of how the patient is sleeping, walking, breathing, and so on. That will be dense in time, it will not contain human biases and errors, and it will have much higher fidelity than what we're currently collecting. This will lead to major labor savings, but also improve insights about patient health and lead to better patient outcomes.